Hello, a very warm greeting. I am Dr. Rahul Agarwal. I am a senior consultant physician and a geriatric specialist in Care Hospitals, Gachibowli. So today I am going to talk about a topic which is normally not commonly discussed. That is leg swellings. Lot of us suffer from leg swellings. Both the legs will be swollen up. We have seen it very commonplace, and lot of time the first thing that comes in our mind is, "Arey, I have got some kidney problems." Actually, there are several reasons for having a leg swelling. So, if the leg swellings are in both the legs, we will try to find out basically five important things. Anemia, a very low hemoglobin will cause the leg to swollen up. Second is heart failure. A lot of people who have got heart diseases in which the heart is not functioning properly, the pumping action of the heart is actually not so good. They will also have a leg swelling. But along with that, there will be other causes, other symptoms that will be there with the heart disease, like chest pain, chest discomfort, breathing trouble, easy fatigue, all that. And then people will be old, and sometimes they will also have hypertension, diabetes, or sometimes they will have a coronary artery disease that has been proven by doing a coronary angiography. So all these are the factors in which we will have leg swelling because of the heart failure. Of course, when there is a leg swelling because of heart failure, you go to your cardiologist, he will prescribe you some medication to bring down the swelling. Normally, there are diuretics that we use. Beyond that, the more important is why the heart is failed, whether it is because of low blood supply to the heart, whether the muscles are involved. There are several causes by which the heart will be not functioning. Even certain infections, like we have seen in COVID, we have seen in dengue, we have seen in swine flus and other viral infections, they might also present as heart failure and leg swellings. So this is the second important cause for leg swellings. Of course, anemia, that is lack of hemoglobin, till up to around 8 grams percent, you won't have too much of a symptoms. But if the 8 grams of hemoglobin has come suddenly, like somebody has got a lot of blood loss, yes, you can have a symptoms. So you need not worry every time that it is the kidney failure that is causing the leg swellings. Anemia again can be of lot of reasons. Somebody who is nutritionally very poor, like the iron is very low, like vitamin B12 is very low, or somebody has got the red blood cells which is destroying very fast, that also causes anemia. Even chronic disorders like having kidney disease or thyroid or diabetes or cancers or even diseases of the bone marrow, sometimes even infections of the bone marrow, all this will cause anemia. One more important cause of anemia is blood loss anemia. Blood loss anemia usually happens because of gastric ulcers, piles or hemorrhoids. Sometimes in females there will be a lot of blood from the menstrual blood. If the menstrual blood is clotting, it means that the bleeding is high, and then there will be anemia, in which the overall body's production of hemoglobin will be outweighed by the blood loss. So there is a net amount of low hemoglobin and anemia comes. The third most important cause of both lower lobe limb swelling is thyroid. Lot of people don't know it. Hypothyroidism, that is low thyroid levels in the blood, can also causes lower limb swellings. So in fact, most of the body will be swollen up, the face will be swollen up, and it's a very easy thing to treat a thyroid problem. You need to check your TSH. Based on the TSH levels, your doctor will give you thyroxine medicines, and most of the time after taking thyroxine medicines, the leg swellings will be much better. Fourth important cause is liver failure. So we have got several causes of liver failure. One of the most important cause of liver failure across the world is alcohol. Once too much of alcohol is taken, and then alcohol will go and destroy the liver cells, and then that will cause the liver to fail, and then there will be a lot of less proteins in the blood, and then that causes leg swellings. Another cause of liver failure is hepatitis B and hepatitis C virus infection. These are two viruses which will attack the liver, and cause the liver to fail. Another common cause of liver failure, which is now rising in the Indian population as well as the Western world, is non-alcoholic fatty liver disease. Because of the way we are living nowadays, lot of obesity is there, lot of fat in the blood is there. All that will go and deposit into the liver and cause the liver to get failed, and then there will be a liver failure, and that's causing both the lower limbs to swollen up. There are several other minor causes of liver failure which we can discuss it sometimes later. The fifth most important cause is the kidney failure. Yes, you are right. Whenever the kidney is not functioning properly, it will not be able to pour out proper urine. Whenever the water is not going out of the body, you will be having a lot of water retention in the body, and then there is leg swellings. So every time there is a leg swelling, there is a no need to be very panicky, but of course leg swelling is not a common phenomenon. You have to be aware that whenever there is both the leg swelling, don't take it very light. You have to go to the doctor and properly investigate yourself. One rare cause of leg swelling in females who are after their menopause is idiopathic leg swelling of the menopausal woman. Sometimes because of the lack of hormones, there will be excess water retention in the body, and that might cause the leg to swollen up. There is a disease in which there will be too much of hormones, steroid hormones in the body, that is a Cushing's syndrome. That again will cause the leg to swollen up. These are the general causes mostly which I have told you that will cause the leg to swell. But if there is only one leg that is swelling, then we have to look for other causes in the leg itself. The most common causes is an infection or cellulitis of the leg. Meaning if somebody has got a leg infection, that will be painful, red, swollen, and then the temperature will also come. Normally this happens if there is a trauma, meaning a cut or a wound. Sometimes in diabetics you don't have a trauma also, but the leg is infected. Then filariasis is another one important cause of leg in a single leg, swelling in a single leg. Filariasis can be acute, that is immediate, or chronic. If the acute filariasis is there, we will have what is called as a pitting edema. If meaning we will press on that leg, there will be a small dimple that is formed or small depression that is formed. But in chronic filariasis, the leg becomes very thick, and then if you keep on pressing, it doesn't actually have a dimple. So another one more cause for leg swelling is varicose veins. Sometimes it is a single leg that is involved, but most of the time it is both the legs that is involved. Veins that supply the lower limb, that is the legs, they carry the water from the leg into the heart. They will have valves. If sometimes the valve is not functioning, the water will not be able to go to a single direction towards the heart, and then the water will keep remaining in the leg, and then it will be swollen up. Occasionally there will be a joint that is causing the leg to swollen up, like the knee joint infections or arthritis or uric acid levels that is increased, or what you call as gout, or in fact sometimes because of an infection recently because of a virus, the leg will have a painful joint and swellings. So in effect there are several causes of leg swellings. You have to go to the doctor, you have to evaluate yourself thoroughly, and most of the causes that I have told you are reversible. So there is no need to be very worried or too afraid, but you have to be very vigilant also. You cannot take it easy that somebody has got leg swelling and you can just wait for nature to take its course. There should be some reason, we have to find the reason and treat accordingly. So the general things that we ask for a patient who are having leg swelling is to just sit with some elevation. Like if I am sitting now, I will use a stool to keep my legs up. Similarly, if I am lying down on my bed in the night, I will put a pillow below the mattress so that it is a little bit higher side. So all this will displace the water from the leg into my back. So that is a temporary measure that we can decrease the leg swellings. But of course, you should be very careful whenever there is a leg swelling. So the take home message is that there are so many causes for the legs to have swollen up, to be painful or even non-painful. So you have to go to the doctor whenever you see somebody's leg swollen up. Thank you.